up to 72 hours after a spinal cord injury if we apply this combination of nanovirus and glycine alone or in combination with other drugs, up to 8 hours. But we apply topically here because we are not sure how much fraction of this drug can really enter to the spinal cord. The other problem is that if there is edema and microhemorrhages, intravenous, we have some problems. So at the moment we are trying topical applications, and we have started after 4 hours and then 6 hours, and we can see that the changes are reduced up to 48 hours in our hand.
More questions? Yeah, I think
so. Thank you very much, Ari, for this absolutely great overview, and I'd like to acknowledge the enormous contribution that you have done, particularly in relation with comorbidities in various type of disorders. And I think this is a very important highlight. What we have achieved together in the last decade is very much related to the new generation of animal models, which are strongly considered I would say, the real life. Because with as you mentioned, yeah, we have animal models in TBI with anesthesia and so on and so forth. We have animal models with healthy animals and so on. So I think we can be closer to a better implementation of translational concepts only if we consider animal models closer to the clinical reality. So I think we should do that, and we should mention that the animal models with various comorbidities really contributed to a better understanding of the mechanism of brain protection and recovery, namely the hypertension animal model and the animal model with double and triple comorbidity, hypertension plus diabetes, and even hyperthermia. So these three factors combined in one animal model will totally give us a different perspective, and I'm very grateful for all this development that we have done. So thank you very much.
This is our collective achievement, and we should all be happy about that.
Nicole.
Thank you very much for the talk. Which animal models would you suggest in sheep? Would that be closer to humans, or which animals would you suggest?
Well, in the United States, there is an agreement, there is a spinal cord or neurotrauma association, and it was ruled that all spinal cord injury experiments should be done on rats. This was long ago, Ellen Faden and many others have suggested. And of course, they have also suggested the way of impact, but the rat model is quite close to the human, and even you go to sheep and even elephant, I believe that, or even pig, I mean, it is very difficult to reply the same thing in human cases, although all animal experiments have certain limitations. So far, that's the reason we are concentrating on rats as animal model.
So I think it's absolutely right, because it's easy to build up comorbidities in a rat, and maybe in some respects for some types of disorders and some animal models now to create an extra link, will be useful to consider also primates, but. This happened in the stroke research, for example, with a new molecule with inhibitors of PSD95, which is super selective inhibitor of the extrasynaptic pathways. The latest animal models in this respect have been developed by the group of Shavitz in primates. But I think rat will continue to be one of our main let's say, drivers in animal models. And I think what we shall do is rather to develop to a better protocol all this animal model and animal research. Comorbidities, then to have double blind. Now it's a lot of discussion to have double blind groups of animals, to double blind the investigators and also the rest. Then to have a combined analysis and to have multiple investigators involved in this, and even multicentric animal model trials. So I think we still have a lot of room for the rat. What we shall do is just to develop and to upgrade our knowledge and to push it to the ultimate border.
Even in rats and mice, there are lots of differences, and therefore the experiments done on mice cannot be very close to the animal model, and therefore all experimental biologists and experimental traumatologists in the United States, there is a regulation that all experiments should be done on rats in relation to the traumatic brain and spinal cord injury, and this is a very old information, and that's why most of the labs, I think 90% of research labs are using rats. And even using rats, there are different strains. They have quite different things, because in NIS they are using Longevans, and most of the laboratory they are using Longevans and then Vistar and so many things. So there is a standard practice of using rats as a laboratory animal. I will stop here.
Yeah, I know that. I mean, obviously, but there are movements in Australia, like now, for example, trying to introduce sheep. This is why I asked, and there are reasons for it. But anyway, I accept, and I think this is, continue on that road.
Okay, thank you.
Okay, just one last question from my side.
Yes.
Hi. How is the development of this technology? Is it possible to use it for the administration of sterilizing to humans already or not?
In University of Fayetteville, Arkansas, they are using nanowire drugs for the treatment after knee operations, and they are using certain kind of drugs for faster recovery. So I believe that there is theoretically no problem in delivery of cerebrolizing in human cases, nanowire delivery.
And the administration in this case would be directly to the brain, or which way of administration would it?
You can also use topically. That is one of the example if the brain has some opening in human cases like open brain injury, or also it can be delivered intravenously, because titanium nanowire so far is completely innocuous up to a period of 6 months to 8 months that has been published in many Springer journals.
And intranasal would be possible, or because it could be one way to reach the brain intranasal?
Yes, in traumatic brain injury there are some opening of the barrier. On the other hand, there is also inflammation. So it is the question of time, because this is applicable to all kinds of drugs, the same phenomenon.
Okay, thanks a lot.